known for his expertise in nose surgeries and hair restoration. He completed his medical degree from the University of Miami Miller School of Medicine, and then further specialized in facial plastic surgery and reconstructive surgery through a fellowship at the University of Chicago, Illinois. He is also recognized for his academic contributions as a clinical voluntary assistant professor at Florida International University College of Medicine. Dr. Barrett is praised for achieving natural-looking results and is committed to a patient-first approach, ensuring thorough consultations and clear communication to meet individual aesthetic goals. His reputation is built on technical skill, an aesthetic eye, and a compassionate approach to patient care. Welcome, and thank you for being here.
Thank you.
Perfect. Okay, so to start off with this conversation, beauty from the inside out means so much to me because this is something that I've been doing for approximately 15 years. I believe that to achieve a patient's ultimate results and for them to look and feel radiant, we need to approach them from the inside out. So what I'm wondering, and where my question is going, is what lifestyle practices and self-care routines do you recommend, each one of you, for your clients and patients to achieve the best results? Who would? Perfect.
Thank you, Marion. I love this topic because I'm a very spiritual person, and I believe that the mind, the soul, and the body are interconnected and are one. So if the three of them are balanced, then you will be fine from the inside. And I think everybody knows the basics. If you don't exercise, then you'll have sagging skin. You won't be firm. If you don't sleep, you'll have dark circle under bags. If you don't eat well, it will show on the outside. So I believe everything is really from the inside. But mentally also, how can you be beautiful if you're stressed? And the key driver of Furcy Botanik is stress relief. You might wonder why, because stress and skincare, how do you relate that? But you see, one of the effects of stress is inflammation. And when Harvey and I met, Harvey is my partner, the beauty guru. I'm so grateful to be working with him. He's not here today. When we met, he always told me that the cause of most illness is inflammation and also affects the skin. So we found this unique natural ingredient called jonjon. It's a mushroom that only grows in Haiti, and it has superior anti-inflammatory benefits. And we were so amazed with the results of all the tests that we had done. We had done a beta-glucan test, and we had seen that it was 2 times more powerful than hyaluronic acid at the same concentration. We found out so many amazing things about this ingredient. And we realized that it really helps with stress. So that was really our driver there, because most of everything is stress. The world is stress. So when you travel, your skin is affected. When you're stressed, you have pimples. I just shared a post actually for my wedding. I have so many pimples because I was nervous. And it has not happened since. Ever since I started using Furcy Botanik, it's gone. It really adapts to every environment and any stress around. So for me, I completely agree with the approach of beauty in a holistic way. You really have to be well in the inside in order to be good outside.
That is wonderful. Yeah. Yes, and now we hear more and more, one of the hallmarks of aging is inflammaging, or this inflammation that ages you prematurely, and stress, of course, is one big component. To my patients, I always recommend having like a meditation and breath work practice, because stress will destroy collagen and it will age you prematurely.
Definitely.
What about you, Dr. Barrett?
No, definitely. I'll piggyback off of that. Inflammation is a huge component of my practice, and I'll address this question from the perspective of hair loss, hair restoration. I think to start with, the most important thing for people listening, for patients, if you're experiencing hair loss or you're concerned about, shedding, whether it's women or men, the most important thing is to start by seeing a licensed medical professional. I think there's a lot of misinformation out there in the hair industry. The hair industry is, as we all know, a multi-billion-dollar industry. So with that comes the Wild West, if you will. There's a lot of information out there. I'm a firm believer in tests, in qualitative tests, research and background, and anything I do and I prescribe. And I'm not the first one to maybe recommend or do something if it really hasn't been validated over time. So I'm a bit conservative in that regard. But to start with, seeing a licensed medical professional, getting a proper history and physical examination, because so much of what we can determine comes from our medical history, our medical background, our lifestyle changes are extremely important with what we do. And I think that the bottom line when seeing a medical professional is, especially when it comes to hair loss, is determining what we can control. Because there's a lot of things that obviously we can't control. So through proper history taking, proper physical examination, and then lab work, blood work. There's a lot of things that we can find in blood work and lab work that may be off and then may be exacerbating or even causing hair loss. So determining what we can control, because a lot of things, unfortunately, we cannot. Once we determine what we can control, we adjust and modify based on a person's individual lifestyle, whether they want to be compliant with topical versus oral medication, for example. But then, of course, I can't stress enough is exercise and lifestyle changes. I always tell everyone, and that's a given. And inflammation. And I'm a big proponent, and I'm a big advocate for an anti-inflammatory diet, whether that be through the Mediterranean diet or by any means. There are specific anti-inflammatory diets, which of course will always help with anything, particularly hair loss.
Wonderful. I love your holistic approach. That is wonderful to hear. So going back to the stress part and the how you're feeling, there's a phrase that they say, when you feel good, you look good. You radiate this feeling. So what role do you both think that mental health and confidence play in achieving optimal results with your patients and clients?
Well, I used to think that this phrase was cliche, but it is so true. And I've experienced it myself many times. And you do feel confident when you look good at the end of the day. You can see someone pretty, but they don't look good. Looking good truly comes from the inside. I believe in vibration and also how you vibrate. You see me? I always think that when you vibrate from love and above, you always are vibrating at a very high frequency. For example, joy, enlightenment. When you're getting married, you're happy. When you're passionate about your career, you're radiating so much. Your eyes are sparkling. It all comes out. When you are signing a contract, whatever you're doing, it vibrates. But when you vibrate from love and below, which is fear, anger, resentment, guilt, all of this, it really shows on the outside. I think that is just a mix of everything we were just talking earlier. It has to do with mental, spiritually, and physically. You have to be well inside in order to be beautiful outside. That's for me. And also one of my practices that helps me, because when I'm feeling and I have a very low energy and I have low emotion, in order to shift it, there are many things you can do. I mean, people do yoga, people listen to music. Me, I like to use scents, perfume. I like to create perfume to uplift your spirit. And my previous brand, I used to do, I would do something for love, for zenness, like for anything that you need. And for Furcy Botanik, I specifically used the vetiver from Haiti, which is today, I'm so proud to say, the best in the world. And it soothes and relaxes you. So we added this to all the Trio Magique, the 3 products, and just so that when you do your routine, it's not just you applying a skincare, but you're also doing a ritual. You're feeling like you are in the middle of nature. Actually, everyone received, I think, an essence spray. Just spray it, and the smell that you smell is something I smell when I'm in Furcy, and I wanted everyone to experience that. Like, even if you're in the city, you can be in nature. So yeah.
I know that smell is beautiful. I appreciate that smell, and I've been spraying it on me since yesterday.
That's great.
Yes, lovely. And for you, Dr. Barrett, mental health must be a big component of your practice. Can you tell us about that?
Oh, absolutely. I guess I'll address this question from the perspective of rhinoplasty, which is a big component of my practice, and any cosmetic procedure for that matter. Rhinoplasty or cosmetic procedures are not a panacea. They're not going to fix or address any sort of underlying mental health issues, which unfortunately, I see patients that come with that approach. So my job, obviously, as a surgeon ultimately, but prior to that, as a physician, is to choose the best candidate for their own sake. So that is really, how do I do that? I listen more than I talk in consultations. I meet with everyone multiple times, definitely more than once prior to any surgery, because albeit when I do perform a beautiful procedure and the patient's level of esteem remarkably does go up, but the important thing is what underlies that, because frankly, I may have helped, but I didn't cause that. There has to be something within a proper mental state for you to get to that level, and I'm just there to facilitate it. Granted, it's a very technically, what I perform is a very difficult surgery, so I have to set very proper expectations for patients, and then help them get to that place. I'm not a therapist. I'm there to operate, but I always try my best to listen and determine whether this person is the best candidate, is best suited to undergo a cosmetic procedure. And if so, it's a beautiful thing, because we both undergo a process, myself and the patient, and it's something that ultimately we could both get to a really nice place together. So mental health is a huge component of what I practice.
That's wonderful, and I'm glad that they're feeling more confident after
Absolutely.
getting the surgeries, of course, especially hair, noses.
Yeah.
That is the one thing that everybody
Yeah.
seems to
There's
notice.
a lot of pressure because as a facial plastic surgeon, obviously, our first impressions are the face. So,
Of course.
and I think the biggest thing to just I'll go off of the subject is providing for a natural looking result. Because to me, there's nothing, if you have a telltale sign of a rhinoplasty or hair restoration, if it comes to that, that makes people self-conscious as well. So giving them a natural result so that, like we talked about, that natural beauty can come out. And that's how I could help, at least as a cosmetic surgeon, more than anything.
Of course, I love that approach. Now, I have a question. With your patients, you're looking for this natural results, but are there any practices that you do before the surgery, like skincare? I know you do a lot of facial hair transplant. Like, is the quality of the skin important? Do you give any supplements? I don't know, I've seen these red light caps for hair growth or regrowth, or do you have any practices that you do beyond just the surgery?
Definitely, I'll start with the perspective of hair. Hair itself, hair loss is, and people are actually mostly shocked when they hear me say it, but I lay it out. Hair loss is a progressive issue. And right now, we do not have a silver bullet, a potion, if you will, that can stop or cure hair loss. So the first thing for anyone to understand is that it is a progressive concern. I'll make the analogy of tooth decay. You know, our teeth are throughout our lifetime, we have to brush our teeth, we have to provide for fluoride. So that's what hair care is. Whether that be, like you mentioned, laser light therapy, or topical medications. Now, fortunately, today we have genetic testing that we could do as simple as a tongue swab, where we could determine genetically what you're best suited for with topical medications. Yeah. It's called the tricho test that we provide, and we can tell you whether that be vitamin D or minoxidil or a combination of medicines to help to offset hair loss. And then ultimately, if it comes down to it, hair restoration. You know, we can provide for surgical hair restoration for those patients with advanced hair loss that have lost their hair.
Wonderful. I had no idea about that test. I love it. We should all get one of those
Now
tests.
we know.
Yes, I am up for testing. I love testing, and having this test is wonderful. In Mexico, most plastic surgeons do hyperbaric oxygen therapy before and after surgery. It is believed that if you do a couple sessions before and a couple sessions after, it helps with like achieving better results and for recovery. Is this something that you use in your practice?
I don't personally do hyperbarics, but I do know of it. I'm a big proponent of it. But then again, it's not something that I particularly do provide for my patients.
Okay, wonderful. Okay, Nathania. We had a talk before, and you mentioned there is a wonderful mushroom that is the hallmark of Furcy, and it is a mushroom, from my understanding, that grows in a special mountain, and you can only pick it within 15 minutes of raining. So could you tell us about this magic mushroom?
So this mushroom actually grows in Haiti, everywhere in Haiti, but only there, not even on the other side of the island. I mean, we are connected with the Dominican Republic, but you only find this in Haiti. And it's a mushroom that we put in our food, and we've been eating it. I've been eating it my whole life. Back in the days, even the slaves used to eat it to have strength. There's a lot of protein in it, vitamin A and B. And I have to tell you a little story quickly. So when I met Harvey again, I felt very grateful because, I mean, such an amazing chemist worked at Estee Lauder, retired, and he's looking to work with me. So he told me, listen, I launch a lot of great brands. Can you give me one thing that is so unique, does not exist anywhere, that I can launch? Because, I mean, he launched, La Mer, Jubilon, you name it. I said, I'm going to look for it. I spent 1 month going crazy, going nuts. I started even asking the voodoo priest, do you know any ingredients? I was going nuts. And finally, one day I was at my cafe and my aunt comes and she's like, I have the right ingredients for you. I'm like, I'm busy right now. She said, yes, it's Jojo. I was like, oh my God, how did I think of that? And I got the goosebump. I called Harvey. He said, oh my God, send this to me. We need to test it right away. So this mushroom is very special because it is God's given. It's not you cannot grow it anywhere. They have tried. Everywhere you can't. It grows right after the rain. After 15 minutes, it dies. And usually we pick it and you let it dry, and when it dries, you put it, in rice, or we do the polenta with it, and we eat it. And Arby always told me, if you can eat something, then you can put it on your skin. So after, we tested this mushroom, we saw the potential was so amazing, we decided to bioferment that mushroom. And that's when we found out that we had very superior anti-inflammatory properties, also antioxidants. And we made a garden with our products. We started taking the hibiscus, the vetiver, and we got a few amazing botanicals. That's why it's Furcy Botanik. But I have to tell you quickly, if I have time, what Furcy is, because it's Furcy Botanik. So Furcy is this village up in the mountains in Haiti. It's 45 minutes away from the capital. I used to go there in the summers and the weekends with my family, and I know I reached there when I saw the soil was turning terracotta red. So it's not like, it's a different color. It's the color of our packaging. and everything smelled extra better. You could smell the pine, there's a mist, you're above the clouds. It's like it's a magical place. So I fell in love with this place, and it's very dear to my heart. My husband and I, we have a foundation there also, and the Kids of Furcy, which is related to the brand. And this is when we started like picking up all the botanicals there, and that's when we decided, let's use this mushroom. You know, this mushroom for us is everything. And I think I'm done with the question. I'll let you ask more questions. I can keep on going because when we talk about the JoJo, I can talk about a lot of things. We also figured out when we did the 3 products, we did the consumer testing, the in vivo testing, you name it, and we saw, which was a challenge for us, we saw that it targets everything: dry skin, redness, wrinkles, dark spots. It's not good news when you have all this good stuff, because usually when you're in skincare, you need to have one target, you know. It's good for just that, but it really is for everything. It helps with pores, and I'm happy to say that we have had great results, great feedback, and everybody that uses it, they keep coming back to use it. So this mushroom has been really magical for us so far.
That is wonderful.
I'm done now.
No. And about the results that you're saying, is there any particular person that comes to mind that has had like a life-changing experience or extraordinary the results that you would like to share with us?
Yes, of course. We worked on this 3 years prior to launch. So 4 years ago, we started working on the products, and my friends and my family were my guinea pigs. They were basically trying the products for me, and one of them, her name is Vilma. She had rosacea, and she has tried many things. I mean, she would try them, but it keeps coming back. And I told her, try this. It was the gel crème légende, the cream that you tried last year. She applied it. On Friday, she left with it. On Monday, she came, and I saw her face. I was like, no way. I did a picture of before and after. I could not believe it. I said, keep on using this. And it got better and better and better. Today, she doesn't know any red face, you know. She doesn't see any redness in her face, I mean. Something else that has been changing, or life-changing, it's supposed to be a surprise, but we're coming out with a product next month. But we have been testing it with friends and family, and also, you know, all the testing that we're supposed to do. And we have created our own peptide 300 by doubling our biofermentation of guayaba and jonjon. And the effects are so amazing that you can see the difference after 10 minutes of using it, it depuffs. 15 minutes, you see that it plumps. And after 2 weeks, you see a difference. My sister-in-law right here, she's been using it on her eyes, and after 1 week, all the wrinkles were really fading. For me, this is going to be like a magical product. And when you don't find an appointment with Dr. Barrett, you know, it's called no appointment. It's an I one that's called no appointment. For if you don't find, just, you know, you have a plan B with me.
I love that. I love that. Dr. Barrett, would you be open to incorporating like skincare into your practice? Do you think that's something that's important too?
Absolutely. In fact, even for rhinoplasty, for nose, I mean, obviously it's a central feature of our faces. It's a central feature of our faces. So I always tell patients when they come to see me, if they're bothered with their nose, is the quality of the skin. That's one of the things that obviously I cannot control surgically. So I do anything, whether that's in combination with a dermatologist or with skincare, to help optimize the skin prior and after surgery. There are factors that I can control, but with my patient demographic in Miami, and I see a lot of patients, Hispanic descent patients, African American patients that have thicker, more sebaceous skin in most cases. So for them, I try to then tailor not only the surgical procedure, but skincare to help optimize their preparation prior and after the surgery. So yes, skincare is an understated part of facial surgery.
Wonderful. Now, is there any success story that you can think of that you would like to share, or how successful is hair transplant? Does it work for everyone?
That's a great question. Hair transplant doesn't work for everyone. You need to, like I mentioned, go through the proper channels. Like I said, unfortunately, it's an industry where patients maybe that I see maybe shouldn't have had a hair restoration procedure, but they unfortunately had one. And so I have to do what's called reparative work, of course, based on that. Getting a proper assessment and having an honest consultation as far as your candidacy is very, very important, particularly women. Women, it's a specific subset that are candidates for hair restoration. There's a lot of channels and a lot of things we have to do prior to getting to that point to help optimize women's health and in their hair. But hair restoration itself is something like anything else. It needs to be very targeted, individualized, and it can't just be, monopolized or mass-produced, as unfortunately it is. It's an industry that we see that a lot of.
Wonderful. You probably have heard of PRP for hair. In Mexico, we use a lot of PRP for the hair before, after, and as a preventative measure for hair loss.
For those of you who don't know what PRP is, it's short for platelet-rich plasma. It's a simple blood draw. And from that, we were able to extract the platelets, which is a component of our blood. The platelets have been found to have what are called growth factors. And those growth factors do what they say, it helps stimulate growth. And in our case, hair. So I use it in every single, again, this is something that we did through years that I finally have now used it in every single hair restoration procedure. It's a part of all my hair restoration procedures because it does two things. It helps to provide nutrients for the transplanted hairs, and it also helps to stimulate one's own hair. So hair goes through a process before falling out, which we may not notice it, but when hair starts to, you will notice it as thinning. So when we run our fingers through our hair, even certain parts of our hair, we might feel some parts to be thicker than others. That process is called miniaturization. So hair thins, it goes through this process prior to falling out. And once it falls out, it's out.
Gone.
So PRP helps to reverse miniaturization. And that's really what any hair treatment does, which is the reversal and the stabilization of miniaturized, of that thinning that we experience when we run our fingers through our hair.
That's wonderful. And can you use it as a preventative hair loss?
Absolutely. There's a certain protocol that I use as a preventative means in both women and men, more women, to be honest with you. And it's a regimen that we recommend. Whether if we do it at the beginning every 6 weeks and then we space it out, but it's something that does prevent hair loss.
Wonderful. Thank you. So now I would like to pass on the microphone for anyone who has any questions that you would like to know more about Dr. Barrett or Furcy's brand. Well, we were very clear. That is wonderful.
The plasma for the hair, is it done like once a lifetime, every 7 years, every?
Great question. Like I mentioned, unfortunately, hair loss is progressive. So it's like blood pressure. To make another analogy, we can control it. We don't have a cure yet. So anything we do for hair health it's a lifetime process. PRP being one modality, topical therapy being another modality. But again, it's like using fluoride to brush our teeth. It's a maintenance that we have to, once we notice hair loss, it's important to get ahead of it. So the earlier you see a medical professional, the better, because the earlier, like in anything in medicine, the earlier you catch something, the better the success rate. Okay, so the first treatment is done pretty frequently. We do it every 6 weeks for the first several months, and then we usually do kind of like a maintenance plan once a year.
Wonderful. And now that you were saying this, it came to mind. Are there any supplements? Because there's so many supplements out there that work for hair loss. I'm thinking, I mean, I've heard a few like Nutrafol. Is there any one that really does work?
Yes. Again, I think that it's important, like anything, like I mentioned, a proper assessment. So individualizing it for each person, it's easy. Unfortunately, there's a lot of snake oil in the hair industry. There's a lot of things out there. It's a big industry. So really tailoring treatment. Nutrafol being one great vitamin, which is, doesn't really have side effects of significance, but it really helps to nourish and maintain hair. And I do believe in Nutrafol, yes.
Wonderful. And I just want to do we have any other questions? Thank you.
I'd like to know more about the beautiful product from Furcy we received in the labs bag. When should we apply it? And a little bit more about it.
Oh, of course. So we started with 3 products. We have an essence, which is an essence éclat. We have a light gel cream. It's called Gel Crème Légende. And we have a night serum, serum numidique. So what we do is the essence, the one that you received in your bag, we use it to prep the skin. So it's a treatment essence. It has the pure biofermentation, and it helps refresh, it helps open the pores to apply in the morning the cream. And at night, you can also spray it to apply the serum. Now, I leave it in my bag. I have one that throughout the day, I'm just spraying my face, you feel really, really good, just refreshing. And when it's really cold time, winter time, I tend to also apply the serum in the morning. But it's a very simple, like ritual. You just wash your face, you spray your face, you put the cream, and at night you wash your face, you spray your face, and then you put the serum. And very soon, the eye wand, the no appointment eye wand.
Wonderful, wonderful. Yes, it's gorgeous. I received mine last year in that bag, and it was just beautiful. And I didn't know it worked for rosacea now that you said it. And I would send it for sensitive skin, for rosacea, like just intuitively, like from the feeling I got from it. It's just, it's a lovely,
we are
lovely
getting
cream.
more tests done too, because you cannot just make claims like that. But Harvey had a little rash, and it was really red after surgery, and he just applied the cream, and it really went away. So it's something that it's really effective. It works, and the redness. A lot of people suffer from redness, and you don't really know. I think you have to seek a professional first, know what it is. If you need something stronger, you go with it. But if you can prevent it just by using our product, then even better.
I love it because it sounds like a healing cream. I have a lot of people that come to me with perioral dermatitis. That is a rash around the nose and the mouth. And it has been linked to using very harsh products like abusing retinols, abusing acids.
I'm happy you say healing, because what really inspired us is the Dr. Feuille. If you know the story of Furcy, every village in Haiti has a leaf doctor. So back in the days, we didn't have fully access to modern medicine. So they just, like a lot of other countries, we had to make our own remedies with natural leaf and roots. So until today, we still use it. Like during the COVID time, Haiti had the lowest death rate because we were drinking a tea called Associ. My husband today is alive because of this. it saved his life. We were about to send him to the hospital, and we made these remedies. And we use this concept to make our cream. So these doctors, this leaf doctor tells you, this is going to be good for that, and that, and that, and that. Yeah,
That's wonderful.
thank you.
Do we have any more questions? Well, I truly appreciate your honesty and your time for this panel. It has been lovely talking to you both. I really appreciate you both, and you are so talented. So it's a pleasure to have you both here.
Thank you, Mom.
Thank you.
Thank you.